So good evening and welcome to the kickoff of the Community Recovery Advisory Group, which we've already nicknamed the CRAG. Sorry about that nickname, but it just happened. Just want to tell you how grateful I am to you for accepting the invitation to participate in this group. We know how busy you are, and we appreciate that you're willing to invest time to help the county recover from this pandemic. Let me just talk a little bit about the purpose of the CRAG. First, to convey the needs and challenges of Montgomery County communities in recovering from the pandemic and coming back stronger, providing input on the recovery process for the county, and providing communities with information about the recovery process. An important goal of the Community Recovery Advisory Group will be to ensure that the county takes a whole community approach to recovery. So we're asking you to wear a big hat, so to speak, and represent your area of expertise, not just your particular organization, and give voice to broader interests. So thank you again. Look forward to working with you in the months ahead. And I'm going to turn it over to our County Executive, Marc Elrich.
So I hope everybody's doing as well as one can possibly do in the middle of this. I've given up thinking that people are doing terribly well because I think it's hard on you even if you're not sick. It's just hard to exist in the middle of all this. But it's nice to see everybody and to basically, I am very happy with the number of people who wanted to be part of this and to help reshape or shape our recovery. And I want this, advisory group to work with us to determine both what we do during the recovery, but also create some guideposts for what we do after the recovery. This virus, frankly, much like the shootings or the death of George Floyd and the other, problems we've had with police, they've exposed major fault lines in the social structures in this country. And whether it's racial issues or whether it's access to healthcare, which can be a racial issue, and the inequity of, I find it totally ironic that the people we call essential workers and have sent out to work and are getting sick are some of the lowest paid people in the economy. Not very essential if you're really low paid. So all these things are being, I think, brought to light, or at least for some people, I hope, through this. A lot of us knew these were all issues before, but I think it's kind of made the point that these are serious issues. They're having a serious impact on the community, and we need to think not just about how we get out of this virus problem, but what do we do when we get out, so that we don't find ourselves in the same situation we find ourselves now. So I'm hoping that you'll serve as liaisons between your communities and this recovery committee, that you'll both bring messages back from the committee to the community, and that you'll bring messages from the community to us. If there are things we need to do, if there are things that people feel aren't being done enough, we need to hear that. And so I'm not asking anybody to tell us just good news. Don't expect anybody to tell us what we want to hear. I want people to tell us what is going on in the community and where you see opportunities for the county to do better than we've been doing. We've got, some guidelines for our work. One is, racial equity. We want to be sure that we deal with the equity issues in the community now and ongoing. We want to make sure that we have inclusive involvement here, that we're just not talking to a few people or the same old people, but that we're actually getting deeper into the community for their support, and then to make sure they feel like we're supporting them. We're looking at innovation. One thing that's really clear is the way we do things really doesn't get everything done that we need to do. As much time and energy as we've spent, for example, trying to reach out to some of the most impacted communities, we are not getting the response, for example, in testing that we had hoped we'd get. We need to be able to get more people to get tested, and we need to be able to have facilities in the right place. And we need to figure out in what way is our message not getting through. Over the years, I think we've relied a lot on social media and Twitter and Facebook, and not everybody functions in a Facebook, Twitter world. And that's our responsibility to figure out how do we get deeper into the community. But this is also an opportunity for us, and we'd be foolish to waste it. It will identify areas that we can strengthen and identify areas we can be building a stronger and more inclusive community. And so I'm looking forward to the work that we're going to do, because it's both for the present crisis, but it's for the future of Montgomery County. And with that, I'll just say thank you, and I look forward to talking with everybody tonight.
Good evening, ladies and gentlemen. My name is Elijah Wheeler, and it's my pleasure to serve you all in the role of committee chairman for this important endeavor. First, I'd like to thank the county executive and his team for entrusting me to help guide this process. And I'd like to thank you all for your participation in it. During the day, I have the pleasure of serving as the executive director of the Collaboration Council, our county's local management board, and also as co-chair of the African American Advisory Group to the county executive. I can assure you that it's my intent as chair to amplify your thoughts and voices during this major undertaking. I appreciate the county executive's understanding that the hallmark of any true effort regarding engaging the community is centering that very same community in an inclusive decision-making process. Given the diversity of a county such as ours, there should be no other approach than one like this. This evening, I'm going to ask, as was stated earlier, that you place yourself on mute during the course of this conversation, and that you look to the raise your hand feature as a part of Zoom in your interface to be acknowledged and called upon for questions and conversation. But most importantly, I look forward to working with you all as we jointly identify equitable ways to emerge from this unprecedented event.
Thank you so much, Elijah. My name is Adriana Harshberg. I think I've interacted with most of you, actually I think with all of you over email, so it's a pleasure to meet you virtually. I just wanted to take a minute to give everybody a sense of who is in our virtual room tonight. So if you could go to the next slide, please. This gives you a sense of the breadth of expertise of the Community Recovery Advisory Group. You all are experts in over 34 issue areas, covering this wide range of areas and issues, as you can see here on this slide. And on the next two slides, in terms of your professional and volunteer affiliations, I had to play and adjust with the font and the formatting here to try to get all of your affiliations to fit onto two slides, but they represent over 90 organizations that are cover the nonprofit, for-profit worlds, public sector organizations, and advisory groups. So you all are incredibly connected in our community. And if you move to the last slide, it continues the list. And with that, I'd like to transition to Director Earl Stoddard of the Office of Emergency Management and Homeland Security.
Good evening, and I want to say thank you all for joining us. I want to say also thank you to the county executive for recognizing the importance of this work and convening, helping convene us all. I also want to thank very much Elijah for volunteering to be the chair of the group. And obviously, I want to thank every one of you for agreeing to participate. As Adriana introduced, I am Earl Stoddard. I'm director of the county's Office of Emergency Management and Homeland Security. Also serving as, generally speaking, the disaster manager for COVID-19 and the recovery manager for this effort overall. And I want to share my screen and hopefully describe to you all what exactly it means when I say that oh wait, we'll see if I can share my screen here. Cannot share a screen while others are sharing, so I'm not sure, is that Ben? There we go. Okay. I'm going to take you through a few slides, obviously just to make sure that we are all coming into this with the same understanding of what the role of the advisory group is, where you all fit within the overall recovery framework, and frankly, what the recovery framework even is. And so, obviously, this event's very different from anything we've encountered in Montgomery County, certainly in our careers at least. And we've been responding as a county and a community to COVID-19 for about 130 consecutive days now. It seems longer to some, and 130 seems like a huge number to others, but that's roughly how long we've been actively responding, working day in and day out to support our communities. In most events that we face, we're able to respond over a few day period, snowstorms and other things. And then our recovery is simply cleaning up the snow, maybe filling some potholes, doing some repairs on some mailboxes that we've hit with our plows and things like that, and we go on about our lives. But in this kind of event, it's much, much more than that. And many of the issues that we are expecting or seeing in COVID-19 have not fully revealed themselves. They'll be significant, but some of them are still unknown or unfolding even as we sit here today, thinking about recovery. So what's the difference between response and recovery? I think this is going to be important to frame some of the work that we're going to be doing. So when we talk about response, we're really talking about the focused effort on immediate life safety issues. And so, for example, helping those who have COVID-19 today. That's our response activities. We're preventing people from getting COVID-19 today. And so obviously those things include expanded testing capacity, contact tracing, keeping people from starving because they've lost their work, acquiring and distributing personal protective equipment, preventing hospital surge, those kinds of core activities. When we talk about recovery, however, we're focused on what comes after, both reducing the long-term impacts of COVID-19 and making Montgomery County better after COVID-19, using this opportunity that the county executive alluded to. Now, examples of that: addressing long-term health disparities, improving digital service that county government and our partners provide, getting the education system operating and reducing the impacts of that lost time and development of students in the classroom, restoring and expanding economic opportunity, and preventing homelessness or evictions from loss of houses and businesses because of the economic impacts themselves. So these are all aimed at explaining the dichotomy between response and recovery. Now, recovery itself is a big idea. It's not just reopening. And many times early on, people have thought about reopening as being recovery. Reopening is a part of recovery, but it is not everything. We need to innovate. We need to have safety and equity considerations. We need to think about education and behavioral health, economic revitalization, addressing the digital divide in our communities, addressing the workforce mismatch that may exist in the future economy that COVID-19 has helped create, a much more digital economy. Does access to broadband or Wi-Fi affect the ability of our workforce moving forward in Montgomery County to do the work that has to go on? These are the ideas that we're thinking about in recovery, and it's thinking about the long game here, making changes today that can help mitigate or reduce the impacts of COVID-19, or in places where COVID-19 has illustrated those underlying issues, doing more to address them. So the vision for recovery, the county executive already alluded to these 4 core principles. I will not belabor them. These are our guideposts for how we're going to make sure that our recovery framework is operating the way it should. Phases of recovery. It's important to understand that this is going to be a very long process overall. I mean, I would expect that COVID-19, if at some point in the future there will be a vaccine, but the impacts from COVID-19, whether it's morbidity, mortality, the economic impacts are likely to long outlast the actual spread of the disease. And that's important for us all to recognize. So what we've done is create a framework, which is this is going to seem really complicated, and we don't, I'll certainly share the slides with everyone so you can get more familiar with this. But I think the important point is really just a framework to coordinate ourselves. It's not meant to be sort of prescriptive about how we recover necessarily, but it's meant to be a structure that allows us to be coordinated in however we make decisions. We know that we're entering very difficult financial times for the county, for our residents, for our community, but there are certain key things that we have to do, sort of regardless of the financial situation, and we want to be able to prioritize those activities and make sure that they happen. So this is the top of the structure, and I'll get to the bottom of the structure in a second, but this, this structure is meant to illustrate that this is a partnership between the county executives branch, county council, and many partners. As you can see at the top here, there are 3 core advisory groups. The Public Health Advisory Group largely talks to Dr. Gales and gives him advice about the pace of reopening, things to consider, how do we protect the community, things like that. The Economic Advisory Group is largely comprised of our business sectors that give the county executive and county council advice about how we make decisions for our businesses, what kind of supports they need from the county to be successful and to flourish. And then the Community Recovery Advisory Group, as we've talked about, is largely you guys talking about exactly how we make sure that our full community is represented in our recovery process, and how they can be, how we can best serve the very diverse community that we all know is the fabric of Montgomery County. So the Public Health Advisory Group has been meeting for about a month. The Economic Advisory Group has just stood up over the last couple weeks, and you are here as the first meeting of the Community Recovery Advisory Group. Now, I wanted to highlight a couple other things on this structure. You can see that there's a Recovery Executive Committee. Chief Administrative Officer Klein oversees that committee. It's largely comprised of Dr. Yales is on that committee, Rich Madalena, our Office of Management Budget Director, Tiffany Ward, our Chief Equity Officer, is there, Debbie Spielberg, a Senior Assistant to the County Executive. And then we have members, we have Council President Katz and Marlene Michelson, the Executive Director of the County Council. And then we have missionary leads. I'll talk just briefly about the mission areas in one more second. But they basically provide some overall day-to-day oversight to the structure of our recovery framework. They help adjudicate policy decisions. We obviously, as you can imagine, in a big recovery effort like this, there are sometimes competing interests where 2 different areas think that something should be done in the moment, and there aren't enough resources to necessarily do both things simultaneously, or maybe they need to be integrated more to have a joint effort, and those are the kinds of things that the Recovery Executive Committee helps us do. You can see directly below that the role of the recovery manager. I simply am a facilitator. I help sort of funnel things down to the functional areas, the mission areas, and they funnel things back up to me, to the executive committee. And so I just help to make sure that this is a coordinated effort, and every day making sure that the meetings are going off well, making sure that the timelines are being met, making sure that we just get the work done, and we can then share the information that comes from that work. And as you can see, there are a couple other areas where we've got a communication structure within our recovery framework, and a fiscal sustainability unit that starts to do some of the measurables in terms of what are the impacts of a decision that we've made or want to make on the long-term sustainability question of the financials. Can we utilize grant dollars for it? Can we seek a grant to do something? That's the kind of thing that the fiscal sustainability unit deals with. Now, the last thing I want to highlight is the bottom of the framework, and this is really where the rubber meets the road, as it were. These are our mission areas. There are 5 mission areas: government services, operations and services, economic revitalization, health and human services, housing, and education. These are 4 or 5 core areas where we expect to have recovery activities. Underneath each of these mission areas, there are a series of work groups. Now, the key for you all to understand is that these work groups will come and go. As issues rise to the top, a work group will be created that's time-bound and has diverse membership that's aimed at addressing a particular issue and developing an output of whatever kind. It may be legislative, it may be a budget proposal, it may be a guidance. They'll do that work, they'll provide the deliverable up the chain, we'll share it with you all be able to think about it and work on it. You'll also have the opportunity to say, hey, the county government really should be doing this thing. and we'll take it down. We'll identify which work group it corresponds to, or create a work group that it should correspond to, and really have that work be done within the county government based on your direction and input. And so it's really meant to be a two-way street, but this is really where the rubber meets the road on getting things done as it relates to our recovery framework. We're very fortunate to have great leadership in our mission areas. Deputy Chief Administrative Officer Friba Casiri oversees the government operations and services. Assistant Chief Administrative Officer Jerome Fletcher oversees the economic revitalization, which is frankly his sectoral responsibility within the county executive's office. Dr. Raymond Kroll, our Director of Health and Human Services, rightly oversees our Health and Human Services mission area. Asim Nagam, our Director of Housing and Community Affairs, oversees our housing unit within the mission area. And Dr. Darian Pollard and Dr. Munifa McKnight. Dr. Pollard is obviously the president of Montgomery College, and Dr. McKnight is the Deputy Superintendent for Montgomery County Public Schools. And so we've got great leadership for our mission areas to really keep us coordinated and working well. And I think the core thing here to understand is these mission areas are not solely comprised of county government staff. There are nonprofit partners, there are community partners. In the housing area, for example, we have property managers and landlords participating in these groups. And so we really wanted to get the people who are related to a particular area who actually have some knowledge about the subject matter and frankly, some skin in the game, as it were, because they're directly involved in whatever work is being contemplated, participate and really give us feedback on how we should be moving forward in these areas. And so with that, I think that is a good baseline of what our recovery framework is. I'm quite confident that the members of the group will have questions, and certainly I think that's a good next step for us. But today is probably the meeting where I would say we, the coordinators of this, are talking the most. Moving forward, this is really meant to be an interactive process, and we very much value your feedback on how things should be done, how they can be done better, what we're doing well, what we're not doing well, and all the things related to that. So with that, I'll turn it back over to, I believe, Elijah.
Thanks, Earl. I appreciate that. There were a couple of questions that came in during the course of that. One was asking about that last screen. I'm sure we can share some of these slides with you all if you have interest in looking at it a little bit further. But what we want to do now is open the meeting up for possible questions that we're quite sure you all have. Obviously, there's a chat area, but what we would prefer would be for as many people as we have here. We don't want to inundate the chat room. So if you could raise your hand, if you could look for the raise hand feature, or if you don't want to verbalize your question, if you want to just enter it into the Q&A section within Zoom, you can do that as well. We'll scroll through the screen. We have 90 participants here today, so we may not catch you on the first time around, but we will look for people as they raise their hands. So Monica Escalante, Monica, you raised your hand on the screen. You didn't use your avatar. That's okay. I happened to see you.
I thought I used it, but just to be safe, to ask my burning question. I think the plan and the assessment is really thorough and good. And the only thing that I would add to it, and that's why I'm jumping with this question so early, is airflow for apartments. Because this virus travels in close environments. In many of the apartments where they're overcrowded, the airflow can mean the difference between us controlling this virus or not. And you talked about property managers being part of the recovery plan. I think that's crucial. And sort of this is a very immediate phase of the recovery plan from my point of view, because this is happening now and can stop it immediately. And I know you can't penalize them. You can't penalize some apartments, but maybe all of us together can think of something along those lines, because that would be really beneficial. Thank you. That was my question.
I can chime in quickly. So this is an issue that we've actually encountered most extensively actually in the government services and operations, because we're considering the same issue for the county owned and operated buildings for our employees. And so we've done a fair bit of research on this particular issue, and I had a long conversation with Dr. Gales about it. Particularly, it actually also came up in the education because we're talking about schools and how are we going to be able to operate schools. And what has become clear is the science on this question is still mixed. And that's not to say that we're not we're not willing to make changes and therefore we're just going to ignore it. I think we're trying to understand exactly what the protective change really is when it relates to air handlers and other pieces of equipment that are both in apartment buildings, but also in our office buildings and every other place that you can imagine. And so I think this is certainly something we've talked a lot about and we'll continue to talk about, but I think this is an area where we're trying to get a more definitive sense of what the solution is, not necessarily disagreeing that there's a potential problem here.
Any other questions? Deborah?
Thank you. Thank you for including me. I have lots of questions, but my primary question following your presentation was just, have you already identified timeframes and benchmarks in terms of some sort of a structure that you're looking to meet, even if they're preliminary? Or is it still pretty open and those specifics are still to be determined perhaps by groups like this?
So we've begun some of the work. Some of the mission areas are farther along than others. As you can imagine, for example, the government operations and services group started very early because we have actually brought back some of our county employees, and they've been dealing with how you safely could reoccupy county workspaces, for example. So they've been thinking about those issues, and so they've done some of their work. Other mission areas are closer to finalized, while even other areas they're long-term issues, and so there's a lot of work to be done to discuss them. And so we've actually been producing a recovery report every week, and I think I'd be happy to share it with everyone on the call so you can see exactly where each of the mission areas is in their respective conversations and what their timelines are for expecting to produce results. And obviously, as they get drafts of materials, so for example, our housing group right now is talking about eviction prevention, really something we're concerned about when the eviction moratorium is lifted. And so once they have a proposal that's more concrete, that's one of those things we're going to bring to you all to review and discuss, and you can give us feedback not just about what the work group had recommended, but also how we execute the strategy in a way that's equitable, inclusive, sustainable, and innovative. And so it's not just the what we do, it's the how we do it. And I'll share we produce the report every Thursday, so what I'll do is probably just wait till this Thursday and share the most current version of it with everyone on the CRAG, and you all can sort of take a look at that, and it'll probably be a good entry point. I think you'll realize that there's a fair bit of work that's actually being done already that you can chime in on.
Thank you.
Earl, we do have a question in the question box. The question is, do you anticipate any impact on the recovery plan by the movement of people from DC or VA to Maryland and vice versa? And what, if any, are the collaborative coordination efforts within the various regional areas?
So the answer to that question is yes. We'll definitely. I mean, we don't have we don't have a wall around Montgomery County, nor do we want one. I mean, it can seem convenient. We've talked about the national conversation is absurd on that topic. We know that people move between borders, and that we will be impacted by the decisions that are made in Northern Virginia, the district, other places in Maryland. Yes, and so on reopening, for example, which is a part of recovery, but not exclusively recovery, we've coordinated very well with our neighboring partners, particularly Prince George's County and the district. We've aimed to do things in a synchronous manner. We are also not immune to what's going on around the country, and places like Florida, Texas, Arizona, and California experiencing the challenges that they are with the virus. And we recognize very much that there will be an ebb and a flow between recovery and response, because we want to recover from this challenge, but the virus dictates the timelines, and we understand that. And so, yes, some of the other, I'll be totally transparent. We're farther along with developing a structure for our recovery than anyone around us is. And so I know the district is actually talking about standing up theirs closer to the fall. We got an earlier start than they did. They had a reopening focus, but their overall recovery structure was supposed to be a September timeline. And so we'll be a little bit more advanced in our conversations than I think many of our regional partners are. But certainly this is a conversation that we have between jurisdictions with regularity.
Peter.
Yeah, considering that the lifespan of this group is expected to be, I believe it was 90 days, as mentioned, 3 months or so, around that time frame. What do you expect the true deliverables of this group are? I mean, within the 90 days time span, is that enough time for us to get you what it is you want from us?
So I think that my answer to that would be, this is the first time we've ever done something like this. So I think we're going to be learning just as you all will be. And I think what I would say to that is, we know that there are going to be some core deliverables that we're going to be producing. Things like the housing group will be doing their deliverables. That'll be very important. The Health and Human Services work group around childcare and other core issues will be developing. And so I think that we'll see what you all, I think it's going to be you giving us feedback as we're doing work. And then we'll reevaluate as to whether the group continues on after the 3 months. I mean, obviously you all have individual other things to do. And I'm sure some of you will say, you know, thank you for allowing me to participate, but I'm not interested in continuing, and we understand that. But I think we didn't want to say this is a 2-year period of service, because obviously you all might say, no, we're not interested, thank you. We'll start out with 3 months, and then this will be a conversation back and forth, whether you all think the feedback that your interactions are useful to you and your communities. And I certainly think you'll be valuable to us, so I don't think that'll be the issue. And so I think it'll be a part of a conversation back and forth that we have in a couple months after we've done some work together to decide whether you all find this time valuable and your ability to coordinate with us valuable.
So next question, what are the resources for adults with intellectual and developmental disabilities who are possibly dealing with stress and anxiety during COVID-19?
So this is a great question, and one that I would much more comfortable giving you an answer after this, because I do not want to miss things that we have available. And so I'm going to ask that one of my staff / partners on the call get that question in good wording, and we'll get you an answer from Health and Human Services, and frankly, we'll share with the whole group. We are doing a fair bit with our DDID provider network, both in terms of making sure that they have ready testing options. We have a behavioral health focused work group in our Health and Human Service recovery mission area who's talking about these specific issues as it relates to this community. We're very much interested in making sure that they have the resources they need during these trying times. I just don't want to give you an incomplete answer, and so I'd like to give it as a follow-up.
Go ahead, Laura.
Thank you so much. My question is opportunities within our work groups to work through other entities that could help our core focus. So I normally work on education issues, and we've been talking a lot on the side about even if we do a full virtual environment, how can we get other parts of the community to help kids that are falling through the cracks and get them in maybe core very small groups to make sure they're getting support and online, etc. So it's hard to do that if you're working in a stovepipe, right? So will there be opportunities to have cross committee work?
So, the answer to that is yes. And so, as it relates to everyone on the CRAG, we'll certainly, you all can tell us what you're interested in hearing about. So, for example, if the majority of the group wants to have a conversation focused on education mission area, I'll ask Dr. Pollard or Dr. McKnight to attend the meeting, and we'll have a discussion about the work that's been done, things that they've considered, things that you all think they should be considering. And so I certainly think that is the absolute case. And just for clarity, I meet with the mission area leads on a weekly basis, and we discuss exactly that. What are the opportunities for a collaboration between groups? What are the opportunities to learn lessons? So, for example, as you can imagine, the child care work that's occurring in the Health and Human Service mission area and the education mission area have to converse and have to work together on those issues. The work that's being done in government operations and services has summer programming, which frankly utilizes our schools and our child care providers jointly as well. And so we are absolutely collaborating across the structures for sure. But I think that extending that collaboration to working with you all is something we're going to look to do moving forward.
Next question is, what is being done to document the structure and process? The hope is that whatever is done can be used to replicate or learn from what worked or what didn't in this case. Next time we might be possibly faced with something like this.
Sure. So I think I'll just give you a little bit of history. So we developed our first recovery plan as a county back in 2013. Actually, before I was the director of the office, I was the worker bee who helped write that plan. And frankly, we didn't like the way that plan was written, and I can say that because I wrote it. And so we actually rewrote the entire plan in 2019 and finished it with a exercise with our directors in December of 2019. I don't want to say we're a little bit serendipitous in that we had just finished our recovery plan development before COVID-19 arrived. And so we had a fresh new plan strategy based on the experiences of other disasters in other places around the country. And so we do have a recovery plan that we are leveraging to do some of this work. Now, this event is far more challenging and involved than any event in Montgomery County recent history. And so we do have a structure, and frankly, we do have multiple members of the team on the call today. You don't see them, but they're there. My deputy recovery manager, Ryan Miller, Tina LeBoy, and Ben Yellen are working here to try and they're going to be recording our taking meeting minutes, notes, and things like that from our process. And we do, as part of emergency management, a very involved after action and corrective action process that allows us to review events and learn lessons from them. We've actually been doing that throughout our response phase. In fact, we have calls every morning to discuss what's working well and what's not working well and make iterative improvements in various phases of that. The same is true of recovery.
Okay, next question. For older adults who do not have access to digital resources, what possible alternative efforts are made to ensure they receive all the essential information to stay safe and minimize social isolation?
It's a great question, and I will absolutely say that one of our biggest challenges is making sure that we have a diverse array of communications tools available to reach the community. And I think part of that actually is why we're here today. This wasn't, this group isn't just an effort for us to tell you things and hear things from you, but also to give you information that you'll be able to in turn take back to your respective communities and keep informed. And so on the specific question of seniors, we've got several programs actually engaged both between the state and the county. I saw amongst our public participants, Odile Burnetta from Health and Human Services, who actually oversees the aging and disabilities sector of HHS. And so I know that her team has been working very closely with the aging community and communicating both through our senior housing centers. Our rec center has been doing senior meal program where we provide information through that venue. We have direct service providers and nonprofits who work extensively with the aging population, aging in place. We have we have several work groups within the county focused on allowing people to age well in Montgomery County, and we've worked with that group to make sure we have information that's going out. And so we've tried to use all of the existing networks that exist within Montgomery County to get the messaging out. We know that in terms of communications, and I know the county executive has said this many times, we still need to do a better job communicating out to our residents in several areas. The older adult population, our Latino community, for example, our African diaspora, all those things we need to do more in, and it's something that we're actively engaged in trying to figure out how we do it, but we promise to keep trying.
What is the relationship nexus between this group and the Reimagined Public Safety Group?
So it's interesting because I actually had this conversation with Raymond Crowell, and there is a fair bit of overlap in certain areas, particularly within the Health and Human Services sector, with the Reimagined Public Safety efforts, particularly as it relates to identifying, mental and behavioral health resources, things like that to expand. And so I don't have a great answer for you today, but it's something we have absolutely talked about. And my guess is we'll be trying to utilize some of the same work groups to do multiple functions if they overlap well. It's certainly something, it's a great point, and one where I don't want to have two different groups talking about the same issues. Where there are overlaps, we will absolutely incorporate those conversations jointly together.
Can I add to that? Hey, Earl.
Yes, you can.
Yeah. So we're hoping that the committee that looks at reimagining policing, some people in this group could wind up on that committee as well. I don't know, because we haven't sat down and named names yet. But at the same time, meetings are going to be open, and we encourage people to listen and just, to hear what's being discussed. I know we've talked about the committee that's being created by the council and myself, that those folks are going to be invited also to listen in on the committee, because we want people working on different threads of all this. We want everybody to have access to the same set of information going forward. We look at that as probably a 6-month process. We're trying to get a report to the council by the middle of January. And we are, in that 6 months, we're looking at every aspect of the police department, everything they do from top to bottom.
Based on the county's press release yesterday around CRAG, what, if anything, or should we do to communicate about CRAG's work?
Sure. So as I noted during the slide deck, I'll show the slides again. We do have a communications wing of our recovery framework. Julie Parker and Barry Hudson, our Director of Office of Public Information, work jointly on, and I would expect that the conversations or decision points this group comes to will absolutely be shared publicly. The other thing is, obviously, these meetings are open. I know that there are members of the press participating in tonight's meeting. I'm sure they'll be sharing the nature of the conversation that we have both today and into the future, which is great. Obviously, again, a part of this effort is to get information out there, and so we'll certainly be discussing, what the most effective methods of doing that are. But I think, obviously, we've, as the county executive said, we've often relied very heavily on social media and other pieces to get it out there, traditional press releases. I think part of this group's core mission is to help us find some additional, more effective avenues of reaching into more diverse and different communities than our traditional press release, Facebook, Twitter messaging would. And so I think that's absolutely actually fair ground for the group itself to opine on and give us feedback on about how we can more effectively communicate some of the things that we're doing or need to do into the communities that you all serve.
I'm watching for hands as well, folks, during this time, just so you're aware. Can you talk more about the breakout groups and how you see those interacting with the larger CRAG?
I think that's a question that we can have a discussion about. And I think if you all, you know, I want to, you know, obviously those groups are very product driven. You know, they use SMART principles, meaning, you know, measurable, time bound, etc. And so I don't think I have an objection. I don't have an objection to you all being involved in the work of the work groups per se, but obviously many of the work groups are sort of already trudging along, and we have to figure out exactly how that mechanism would work. They're not necessarily meeting in the evenings in cases, so I know many of you all have day jobs, and so I'm open to a conversation. If you have proposal, or you know, if you have groups that you'd be interested in participating in, for example, or you have things that you think you would add valuably to those groups, let's have a conversation about it. We're trying to keep this process open, oh, you talking about you meant I'm seeing the chat simultaneously. So the breakout groups, we actually want to talk about this a bit too, in terms of, you know, we were going to break, you know, obviously with 49 of you all working on, you know, on the group, having enough bandwidth to allow, again, I don't want to just talk to you all. That would be totally missing the point of this group, right? We want to hear from you. And so with 49 of you, hearing from you on these large meetings will be very hard, even a 2-hour block. That's like 2 minutes a person, right? And so I think the breakout sessions, we had some back and forth, and in fact, as recently as yesterday, about how exactly those will work. I think is a little bit open for discussion, and I think I'm sure Elijah will want to talk about it some more. But yeah, I think that we certainly need to figure out what the best for you all is, because I know even based on your interest areas for breakouts, there wasn't an even distribution across the 4 potential areas for everyone to participate in. Figuring out how we equitably distribute your all efforts and time to make sure that we cover all the areas, while also allowing you to participate in the groups that you're interested in. So I think we've talked about maybe just doing 2, and maybe doing, you know, for example, maybe racial equity, inclusiveness together, innovation and sustainability together, and that way we can make it a little easier. But again, that's an open conversation that we can have with you.
So John wanted to go back to the other point around knowing a bit more around what's happening in the different recovery groups to ensure that there's no duplication of work.
So as it relates to the mission areas particularly, and maybe this, and depending on which recovery groups you mean, if you mean the divisions of this particular group, then obviously we're going to likely have joint meetings together, and then we'll do breakouts and maybe alternate those so that we'll have time together to discuss, and then we'll have our breakouts. So that'll help keep us from duplicating to some extent. Now, as it relates to the mission areas, as I said, I meet with the mission area team leads on a weekly basis, and we each mission area lead goes through their respective work groups and what they're working on, and opportunities for synergy are identified. For example, we had a homelessness work group in Health and Human Services and an eviction prevention program working in housing. That overlap is huge, so they formed a joint work group. And so this is an example of a thing that's already happening. How we just identify opportunities for synergy, and we've actually in that case merged 2 work groups together to prevent that duplication.
Earl, I would just add, so just for the group, Earl's going to share the weekly recovery report, and that's completed each Thursday. I would encourage everyone to read it very carefully. As Earl said earlier, each work group has a set of deliverables, and they're all laid out, and you get an update on where they are with each of those deliverables, and that will help you understand, one, what they're working on, and also you'll probably have some thoughts about what they should be working on. And that's an important aspect of what we're looking for from this group, is to tell us, what are we missing? You can see how we're doing, but it's important to think about, is there something we're missing that we should be working on? And it can be small and it can be large. And so again, please read through that carefully, and particularly in your areas of interest. And I think you'll find that we are taking a very organized approach to this, and you will get a good sense of what's happening in those work groups, but we need to know where we might be missing something and need to expand our scope.
Thanks, Andrew. And I think as a part of that conversation, when we start talking about the next meeting and looking at some of these subsets or the subgroups here, such as racial equity and inclusion, it's taking a look at that recovery report that you all will receive and looking at or viewing that through those lenses, right? So for the next meeting, it'll be looking at it through the lens of racial equity and inclusion, and having or providing feedback around that as we move forward. So just kind of keeping that framework in your mind, I think, will be helpful. Monica?
And I'm keeping the framework of equity and inclusion right now. And of course, I'm representing the Latino Health Steering Committee here. And you all know that the Latino population is being impacted disproportionately. And while we are thinking about a recovery period for other populations, the Latino group is not there yet. We are on the rise. And, you know, I'm struggling thinking we're going to recover. We are not there yet. 74% of the positive cases are Latinos in Montgomery County. That's enormous. So when we're thinking recovery, I'm struggling here because, one, we're not there yet, and some populations that are being so disproportionately affected by this need more recovery, or are going to end up worse off than others that were able to work from home and not being exposed to the virus in the severe ways that the Latino community has been. So I'm have some dissonance here because I want to feel that I can contribute to making stronger Montgomery County, and think about the weaknesses that were exposed and how do we fix those. But as it pertains to the Latino population, one main weakness that has been exposed is that we don't have language capabilities that allow us to understand what the population needs are and interact with them in all aspects of the response. And I feel the needs of the Latino population are so specific. I don't want to distract the rest of the committee. I don't want to interfere. I don't want to be a problem participant here. I want to contribute, but I'm going to need help from you too with that, just that.
No, we had this exact, a very similar conversation this morning with Dr. Gales and the county executive around the issue of testing. And so we're not in any way moving on from our response phase. Frankly, I spend more time every day dealing with in our response world. I certainly agree that different communities are going to be at a different place in recovery from one another. That's 100% agreed. And frankly, I think there is a very fair chance that we're going to see a resurgence in Maryland, in Montgomery County, in the fall. And we will be back, we'll be full in response mode, potentially. I don't want to say closing things down, but it's a possibility. And so I'm incredibly sensitive to the fact that responding and recovering at the same time is hard. Sometimes there's a competing interest. That's part of my role, is to response gets the lion's share of the effort and resources and all those things now, because that's life safety is the most important thing. And so I think your point is incredibly well taken. It speaks to the challenge of this overall event. Many of the social determinants of health that are driving the issues that we see in our Latino community, our African community, are historic things that have long-term fixes associated with them, but that are impacting the way the response has to go and the issues that those communities are facing today. And so that dichotomy is extremely challenging. This work is not going to be easy. You know, I think it should be very clear to everyone, this is going to be a very challenging thing for this group and the county to struggle with over the next several years. That it will absolutely impact the, you know, the way this administration works, you know, until Mr. Elrich is going up for re-election. And so, I mean, it's going to drive so much of what we do in this county for a long period of time. It's been one of the most significant events in the county's history, and I say all that just to say your point is extremely well taken. And I think everyone would be absolutely well placed to really think about the challenges that are going to be faced by the county of jointly trying to respond and be in a good place to recover from. That's not unheard of in terms of big national emergencies. You definitely have to start planning and putting the framework of recovery down while you're responding. But this event is more complicated than most. Well, I say it's more complicated than any in recent U.S. history, at least.
Thanks, sir. Is the public health group going to work on a plan to deploy the vaccine once it's ready? Who will get it first? Where will the most vulnerable or marginalized receive it first? Where will it be available? Some of those things.
Yeah, I mean, there's already been ongoing conversations with the Health and Human Service around vaccine distribution. We have some experience from the H1N1 event. Not to say that those two events are the same, but at least that was an effort where we had a vaccine developed by, you know, in real time and had to distribute that. So there are lessons learned from that event that will inform how we do it for this event and address the racial equity and other measures there. I unfortunately think we have a fair bit of time to really work that through, because I don't see a vaccine being available certainly in the short term. Certainly not to scale to be in the place to distribute, but to reassure you, there is absolutely a plan being developed that focuses on equitably distributing that scarce resources and getting it into the communities that have been most adversely affected by COVID-19.
Peter, I'm going to come to you in a second. I'm going to get one question in the question box. Will there be opportunities for county residents who aren't on the committee but still have an interest in recovery to give input or feedback as recovery goes forward? A survey, something like MCPS and what they did. In addition, will you be updating residents regularly once decisions are made via social media and other outlets? And will other meetings be open to the community?
There's serious questions there. Other meetings open to the public? Yes. We're going to follow the Open Meetings Act, which means we'll publish the meeting dates. We'll do it similarly to this, where we'll have the panelists and then participants. We'll be posted on social media the decisions of the group. Yes, we're going to tie it into our communication strategy. Will there be an opportunity for more general community feedback on core issues like MCPS has done? I think it's a really great idea. Not one we've fully worked through yet. I'll have to do some thinking about that, but I think it's actually a great idea to do some, surveying of the community as it relates to particular issues. So I think that's a really good piece of feedback, and I think that yes, we should find a way to incorporate a broader array of the county in some of the decisions that we make. So I think that's something we'll take back and make work, and we'll share it, in the near future, maybe next meeting, something along those lines, because I think it's a great idea.
Peter.
Yeah, thank you. I'm thinking in terms of the elderly stay-at-home members of our community. I live in an area where there's a high percentage of people aging in place. Most of them are aging in place without their children or grandchildren in place. Therefore, they're pretty much at home alone. What I've noticed lately is the mental health. I'm not a mental health expert, but I do volunteer with Every Mind Montgomery County, And I do know that they've got the friendly visitor program and their rep payee programs. But how do we go about reaching to these elderly people and enhance their morale? I see a lot of sadness. So I'm wondering what do we have in the plan here under the recovery to help the stay-at-home elderly folks to get them back where they get energized to participate with the community. They can't go to church. They're afraid to go out. How do we get them involved? How do we energize them?
I mean, to be honest, it's a great question, and I think an area of where we would appreciate some feedback from the community on, number one. Number two, we are, as I sort of mentioned before, we are working very closely. Our aging and disabilities sector within HHS has done a lot of work with our community nonprofits to make sure that we're pushing forward resources to get out to those who are providing. I don't want to phrase this correctly. We do have a lot of connections with our senior population through delivery of service in Montgomery County, and so that gives us opportunities to provide them education and information. We did a wellness program through the State Office of Disabilities, but also the State Department of Aging did a outreach program where they targeted seniors whose in-home provider had stopped providing direct care because of the pandemic. They actually had volunteers going out, and still have volunteers going out, to interact with those seniors, to identify their needs, to do an assessment, to work out exactly what resources they might need. And they're connecting those both with the State Department of Aging as well as our local counterparts. And so this has been something that will be extremely challenging. Mental and behavioral health is something that is going to has increasingly become a greater issue. Is one of the focus one of our focus work groups underneath Health and Human Services. And so I think I certainly would recommend when you see the report to take a look at that area and see what they're discussing. And if you think that they're not fully discussing something that you think that they should, that would be an absolute thing to drive them to focus on. So I think it's a really important issue, one that I can't give you a full answer. I'm not a mental health expert. But certainly we have many mental health experts in the county, and getting their feedback on how we reach that population better is important.
All right, thank you.
Pat, is your hand up?
I wanted to know, when we look at the contact tracers, I know a firm is recruiting for them. How are they ensuring that there's diverse contact tracers? And someone had called me and said that they couldn't get on that the training had closed down. Is it going to reopen, or maybe it's already open? I don't know, but do you have any information on that?
I don't on that piece. I do know that we can follow up on that. I mean, it seems strange that it would be closed down. We'll check and see what the issue is there. As far as diversity goes, I think that we've been working with, I think we're going through Athena for the recruitment of contact tracers. And we've been very clear about particularly, both in terms of diversity, but also language skills, and how we can make sure that we have contact tracers that look like our community, I think is the way that we've framed it. I've heard Dr. Gales talk about this. I haven't looked at the specific language that's in our negotiated arrangement with Athena, but that's something we can provide some follow up on to provide some more information about. But I mean, it's critically important. Getting people to provide information through contact tracing relies on them having a level of comfort and understanding with the person whom is seeking the information. And so you can just be more effective if you have populations of people who are diverse enough to understand the varying concerns, feelings of the people whom they're working with through contact tracing.
Next question. While the term of this recovery will have a horizon in the next few years, the experience itself will have impacts far into the future. how is this recovery thinking linking possibly to the Thrive Montgomery general plan?
Yeah, and so that's a really good question, and one that we've talked a fair bit about. And so we've certainly engaged with you know, the Park and Planning Commission as they're working on this plan, you know, sustainability and thinking about how this thinks about this long term. You know, obviously, and it also links into the service access, which is a work group underneath our Health and Human Service Division. Not just access in terms of who, but how. You know, do we have the right transportation infrastructure? Do we have the right walkable areas? Do we have the right locations of services? And are our communities designed correctly to effectively allow for healthy communities? And those are all questions that service access group is attempting to address. And you know, certainly, you know, I know Adriana, we've had a lot of conversation about the you know, the work of the general plan, particularly as it relates, you know, we before this we were focusing on climate change as an issue, but obviously this dovetails right into that same conversation about how we address the long-term implications or design of Montgomery County in a way that helps make us healthier and stronger over the future. And so I certainly think within particularly Health and Human Services, many, I won't say many of, but certainly many issues that Health and Human Services are addressing are get to that long-term planning about sustainability of services and the access to services in our communities.
With constrained resources and at this point in the budget cycle, how will the ideas from this group be prioritized and funded? Is there a mechanism to redirect funds as necessary?
I can answer that. I mean,
I knew I thought you were going to.
There is no mechanism for anything at this point. I mean, this is what we're looking at. We're looking at a budget shortfall of probably $200 million this year. And then the budget we put together next year conceivably could have a larger budget shortfall. And some people think that you have a $6 billion budget, what's $200 million between friends? We actually don't have a $6 billion budget. We technically have a budget of about $6 billion. Half of it goes to the school system. So you're down to a $3 billion budget. When you take out interest payments, principal payments, retiree health care benefits, retirement in general, bond payments, all these things, the county winds up with a little over $1.3 billion. When you take out the money that we get from state agencies and other people that is actually targeted to a specific thing, I get it for this and I have to use it for that. It's not fungible. My budget falls to about $935 million. I can't not pay debts, cannot not pay retirement. The school system's guaranteed maintenance of effort, at least so far, which means they get the same amount of money they had last year, adjusted for school population growth and inflation. And nothing else has an inflator on it. And so we're looking very hard at what are possible cuts we're going to have to make. One thing that I want to do in the short term is use reserves, but I'm not going to use reserves other than to try to keep things stable. We're looking at some other things we can do to save money. We just sent over $66 million in budget cuts. I think 20 something was out of the capital budget, and the rest, 40 million or so, was out of the operating budget. Most of what we took out of the operating budget were things that we knew we weren't going to use this year. So COVID has shut down a lot of activities. And so we took the savings. In HHS, we didn't really cut any programs. We just said, these are programs that aren't going to be running this year. And so we're not going to spend the money. So we took the savings from what we're not going to spend money on. But if we get into the winter, and then if Congress doesn't come up with more money, we may well have to make a second round of cuts. And we're going to have some really tough choices to make. because in that $900 million is all the social services, housing and community affairs, police and fire, libraries and recreation, all out of that chunk of money that's fungible. So to say I'd have a plan, it would be really disingenuous. We're going to have to look at what we actually have and decide with our priorities, what are the things you're going to spend, what we're left with, how are you going to spend it? And that's the tough decisions we're going to have to make. But we try to avoid doing anything drastic right now because we don't know if the federal government's going to bring more money to the local jurisdictions. I didn't want to make cuts and ramp things down or let people go and then discover that the federal government sometime later on says, oh, well, we're going to give you more money and you don't have to you wouldn't have had to make those cuts. So we're doing what we can, the low-hanging fruit today to buy us time to see what the federal government does. And we know what the federal government does, then we'll start reconstructing what we have to do this year and also what we think we have to do going forward. But we have pretty substantial reserves. The reserves were put there for a rainy day. This looks an awful lot like a rainy day. I can't imagine that the rating agencies would question why we used reserve money to get out of this mess. So I'm hoping that when the day comes we have to use the reserve money, that we don't get dinged for it. But we just went through the rating agencies because we're refinancing about $1 billion of current debt, and we came out with a AAA rating. We won't be back in front of them until not this October, but a year from October. So we'll see where we are. But things like this will be priorities. I mean, we're going to identify inequities that have to be dealt with, and we're going to have to weigh how do you spend money to address inequities, and is that more important than some of the other stuff that we're addressing? It's not like the county spends a lot of money on fun and games other than the 4th of July, and we canceled that. So that's about the idea, about as much the idea of fun as it gets in the county budget. Everything else serves a function and serves residents of the county.
There's a little bit of good news, which is we do have $183 million of federal funding called COVID relief funds, and that is for response and recovery expenses over and above, what was planned for, budgeted for. And we've been using that. That can be used for testing, contact tracing, those response activities. We've also put money toward assistance for businesses, for rent stabilization, rent relief, food security, a number of other recovery-related activities and initiatives. Now, Earl and I were just reviewing where we are on those COVID relief funds before this meeting, and we're already seeing that those are starting to get stretched. There are a lot of commitments already made. There are a lot of other ideas coming from our work groups, coming from the council. And we also know, as Earl said, we may face a resurgence in the fall, and we need to be prepared for that because these funds have to be spent by the end of the calendar year. And so if we have a resurgence and we've already spent all the money, that will add to our pain that the county executive talked about. All that said, it does provide some opportunity, for ideas that come out of this this group, through our recovery framework, that we could put some resources toward. And again, this is one-time money. We're going to need to make budget decisions, as the county executive said, for the long term to deal with the disparities and inequities that we need to address. But again, just to answer that question, there are some resources available for recovery, and so I don't want people to think that there's nothing we can do. That you guys have ideas, and we're just going to be saying, no, we have no money for that. We actually do have some options there, but they have to be balanced against a lot of other competing ideas.
Great, thanks. In the chat, there was a conversation around some other mediums possibly to reach out to the senior population instead of electronically, but perhaps a letter writing campaign. Maybe even young people earning SSL hours for writing letters to seniors and helping out and ensuring that I guess it's two-pronged, addressing issues of isolation as well as notifying them around hotlines and other things so that they have access to adequate information. So some good ideas there that were shared.
And Elijah, could I mention that one of our initiatives that we're using COVID relief funds for is called COVID Corps, and it's a summer youth employment program. And we have a lot more applications than we had placements. So that's, you know, those things that you just talked about. Those are things we may be able to bring some more COVID Corps members on to work on. And so this is, you know, again, this is the reason why we wanted to bring this group together to generate ideas that we hadn't thought of. And that's certainly one of them.
Exactly, thank you.
I have a question. I know Laura touched on this a little bit, but you mentioned how half of the budget for the county is MCPS, and I'm just curious. I know there's an education mission area. I think you said that in your intro slides. Can you talk a little bit about how MCPS kind of figures into this and some of the services they provide versus what's happening through this kind of work group?
So MCPS has like near total autonomy from the county government. You know, we have no oversight, we have no policy making decision, and we basically write checks, and the checks are dictated by population and inflation. The good news next year apparently there will be no inflation. So that factor won't be driving things, but of course we know probably for the things they use, costs will go up. That's one of the disconnects between using inflation as a modifier for government, because the government market basket is not the same thing as a consumer market basket. So, but we continue to work with them. And, you know, a couple of examples are things that we want to put more both mental health workers, social workers, counselors into the school. And we may do that the way we've done nurses, where they're outside the school budget. And the reason we did that was because we've learned over the years that we could give money to the school system for a project. That project could end, or they could not actually spend all the money on the project, but that money gets baked into maintenance of effort, so then it becomes usable for anything else they want to use it for, even if it's not what the money was originally given for. So we may well decide the approach to psychologists and social workers is that the county provide the money, because that way it's our money, it's our commitment, and we know the money will stay with the commitment, and the decision would be our decision rather than the school system's decision. So we'll be looking at things like that. We're looking at the SRO program. Very controversial program. Some people want to get rid of it tomorrow. Some people swear by it. I'm not sure where the division falls, but there's certainly a division about its efficacy. But all that's paid for by county money. And what we do in the future may have effects on how we do policing. So when we look at what we're going to do with undertaking reform of the police, part of that discussion will be if the officers are used in schools, for what purpose, and if they're repurposed into the department, for what purpose are they repurposed into the department. So there's a give and take, but there's no one ever really asks for our opinion about what they should do, and there's really not a lot of point in giving it.
Yeah, I mean, I guess to the point, and I'm sorry, I don't remember the name of the person who spoke earlier, but to the point of some of our communities being still in crisis mode, I think that there's a really strong opportunity there to use some of the infrastructure that's in place through the school system, whether it be, you know, the actual school system resources or the linkages to learning that's, you know, supported, I think, by the county's HHS and others. So I don't know, just thinking about that holistically.
So linkages is, you know, is funded by the county. It's in the
Right.
grant process. The schools, I mean, I'm sure they're going to be very leery about using the physical assets of the school. I mean, they're not even going to fill them back up with students. And I know, and Earl could attest to this, when we tried to use some of the building space for nurses and as a health distribution, or even getting our stuff out of the schools, the school system was like, we don't want you in the school, period. And it was very interesting, but they're very concerned about whether the schools remain a safe place. So I don't anticipate being able to use empty space in the school to run or operate different kind of programs. I could be wrong, but I would be really surprised if they said, sure, bring other people in here. I would not bet on that.
Yeah, we have at least discussed utilizing school grounds for increased testing options, maybe even using our school-based health clinics for testing and other options. I don't know where that's going to end up because, as the county executive said, the school system obviously is very protective and you know, in most cases rightfully so, of their property, particularly as they're trying to do joint educational and other opportunities. But I will say, and I've been around long enough to understand the relationship that we have with our school system. They've been more collaborative around COVID-19 than any previous issue that I've worked with. Dr. McKnight, Dr. Gales and I both went out and visited College Gardens Elementary School last week to do a walkthrough of how they want to try and do in-person education. They've been very collaborative on the questions of when schools might be safe to operate. And just, you know, so there's no misconception on this call. We value in school education opportunities from a student development perspective. We're not going to go down a road that isn't safe for the staff, faculty, and students of the school system. And so
Sure.
Yeah.
I think I meant more some of the social services and things like that. And just, given that there are at least 5 or 6 people on this call that I know of who are very strong, you know, advocates within the PTA system and whatnot, like, I hope that you can use us in that capacity to hopefully help, you know, foster further collaboration.
Good.
Just really fast, just to piggyback on that just for a second. For instance, if we do go to a fully remote system, there are families that will still need support to make sure those kids can engage in that remote system. And I've heard some people talk about the concept of micro schools. There's things that we can do outside the structure of the building, right? And so we need to I see that this group could help facilitate some of those out-of-the-box ideas to make sure we're not losing whole communities of kids during this time.
Yeah, even basic needs like food insecurity and other things. So just.
So just sorry to piggyback and chime in, I'll lower my hand, but something that Christy brought up is finding ways to figure out everything that is going on. So there are a lot of PTAs right now who are doing food work and other type of work. And so maybe even using some of us who are connected to get a list of all of that, to figure out what is everything that's happening in our community and make sure that we're not duplicating, make sure that people, at least within a community, whether it's a PTA, whether it's the county government, are getting resources and not make assumptions that, oh, the county government isn't here, but there's another entity that is supporting the community. So I think getting that list would be a huge help to figure out what are the best places to send our needs.
That's a good suggestion.
For hands. Okay, so there's a question around whether or not anything's being done to ensure computer literacy for parents, whether in schools or just others in the community.
So I touched on this a little bit in the beginning, and this is going to be a huge issue. It's already a huge issue. It's becoming increasingly clear that how much it impacts things like the education of our children, computer literacy and opportunity. Access to broadband is a huge issue. The county executive has been very involved in that as an issue for a long time. There's layers of issues here. This is certainly part of many elements of different parts of our recovery framework are dealing with subsets of these issues. So I think when you review the report, you'll see that. But at the same time, and so for example, we've already been talking about making allocations from the CARES Act, current CRF funding, and you'll get used to those terms because you'll hear them a lot, around expanding Wi-Fi access around libraries and things like that to try and attempt to address the structural issues. Now, the computer literacy question is another layer of that same question. We have a workforce development work group, but it obviously goes beyond workforce in this case. And so this may be, I don't want to say this is an area where we haven't done as much as we could, but I certainly think that it raises a very interesting question about how we're attempting to address that question from our structure. And we're not going to have identified everything. That's clearly part of the reason why we've all convened you all, because you'll think about things that we haven't. You'll help us expand our vision of what's important. And so just thinking about the issue overall, there's more work that we need to do in it. And I am not 100% sure we've got the right vehicle to do it, but that doesn't mean we can't have the right vehicle to do it. So when we share the report, please do look, and I'm writing this down to take a look, but also you all should ask that question again once you've reviewed the recovery report.
I think this was touched upon a little bit, but a question that was just sent over was around how much influence does Montgomery County government actually have over MCPS and their possible opening in late November, especially if the government, in this case, for you, county executive, disagrees with the safety of students and staff.
So I'll start on that, and just to be very clear, this is so the county health officer, by virtue of state law, has fairly broad powers under public health emergency. If Dr. Gales said, under my order as the health officer, MCPS cannot open, they cannot open, and that's state law. Now, there's, I want to be, I think we've talked about this, but I want to be clear. The current plan, I think most parents have seen it. I have a 6 and a 10-year-old. Of course, I reviewed the plan. Doesn't have students going back until really small numbers in October. Now, to be clear, if today were October, it's very likely students would not be going back. And I think Dr. Gales has been pretty clear about that. And so the conditions are going to have to improve for that plan to really be implemented. And that's because of the safety of our children, not just our children. Faculty and staff matter a whole lot too. And so I think, the short answer is the health officer has really strong powers to decide what's in the public health interest as it relates to schools or anywhere else. And he's been pretty clear that he's comfortable exerting that authority if we can't come to a solution that isn't safe for students, faculty, and staff.
Thank you. How will the county assist residents in obtaining employment, given the traditional ways to obtain employment has changed? What are the best practices maybe that could be advised upon in virtual interviews, accessing the platforms, and that kind of approach?
Yep, we have workforce development work group that you can see the report from that group. They had a white paper that talked a little bit about improving the ability of Montgomery County workers to operate in a digital environment that actually existed a little bit before COVID. They've greatly expanded upon that effort as we've learned about the relationship with telework and many of our county businesses. And so this is, I mean, we've got an entire work group focused on workforce development in light of COVID-19. So I would certainly encourage you to look at the report from that group, and then let's talk more about that in the future, because there's work being done, but you all should provide feedback to it.
Another kind of question or point is perhaps the county could plan for all departments to review its program and services to identify areas of need or inequity when it comes to minority groups such as the African Americans, Latinx groups, and the Asian Americans.
So obviously there's actually news on that today. And so the council, the executive asked for an expansion. So we have a chief equity officer, Tiffany Ward, that's been with the county. She started right before COVID. And so it's sort of been an interesting transition, I'm sure, for her. She actually did a training for all of the mission area leads and work group leads for the recovery framework. And we're really utilizing our recovery framework as a test bed for her to interact with how we improve racial equity and social justice within county government. And so that is very much a major focus area of what we are working on. We're using the recovery framework to inform how we can improve that process moving forward. Council today approved a $260,000 increase in the budget for that office, allowing us to bring in more people. As the county executive has said before, Tiffany can't train every single county employee on how to build in racial equity principles into how we operate. She's going to need some help to do that. And so that initial investment is, again, in a tough, austere environment, that will greatly increase the ability to really get that program up and running within county government. And like I said, we're using this recovery framework. I am happy for us to be the experimentation place for how we can improve racial equity. In how we very much want to apply a racial equity lens. It's not just you all applying that lens for us. It's going to be at the lowest level in the work groups applying the lens, so that there's been multiple lenses of racial equity being applied to a proposal before it gets to you all. And then you all can have your contributions to that as well. And so it's extremely important to me. It's extremely important to the county executive. It's extremely important to the overall framework, the racial equity be a core principle of what we do and how we build out our proposals from this effort.
Right. Looking for hands. Any hands? Pat.
Oh, I was kind of struggling here. I was thinking about, as we look at the African American community, that because of the many underlying health conditions that we have, and the outcome results in death in most cases with COVID. I'm trying to think about, because I heard recently that now there's probably going to be long-term health challenges. So what kind of planning is going to be put in place to address things now that you probably didn't think, where you may need, more health services out there? What kind of planning is in place to address that?
Yes, so underneath our Health and Human Services mission area, there is a work group focused on there's two work groups. There's actually work groups focused on health disparities, which obviously has the most evident health disparities are those driven along race lines, unfortunately. And so those are going to be, work group's going to focus a lot on that. The access to care is another work group focusing on broadening out and diversifying the opportunities to receive health care, whether it's standard medical care, dental, as well as mental health care as well. And so there are two work groups that are going to take on a lot of that core responsibility. When we envisioned the recovery framework, frankly, it was those health disparities that drove a lot of the creation of the framework itself. We knew that there were going to be short-term things, and we knew that, getting, like, for example, dealing with housing, but we knew that there's going to be these long-term monstrous issues like social determinants of health and health access and health disparities that we knew they existed before COVID, but COVID has really illustrated in a definitive way with clear linkages to morbidity and mortality, these exact underlying health conditions and the racial divides that have underlied those statistics for a long time, but they're been never more clear to anyone than they have been during COVID-19. And we viewed it as, when we created the framework, as a responsibility of the county on behalf of those people who have suffered to use this event with the associated political and social will to make change, to make the changes we need to address in a more rapid fashion than they would have occurred otherwise.
Just to add to that, I was on the phone today with David Trone, and one of the things we've talked about is in normal health issues, no one thought that you had to go to the government, for example, to get a shot or a test. I mean, with the flu, where do you go? You go to CVS, you go to every clinic in the world. I think Giant Food would do it at some point. And the government, the federal government, seems to have dumped an amazing amount of responsibility of healthcare onto the local government. And we are not equipped. We're not equipped in terms of personnel. We're not equipped in terms of money. We're not equipped in terms of expertise. And if this crisis has shown anything, that the next federal administration has to reclaim the healthcare space so that the role that local government plays is more of a coordinator and implementer, and less the body that tries to find test kits and the body that tries to line up PPE, the personal protective equipment. I mean, most people don't know it, but we're selling equipment to businesses and to other entities in Montgomery County because they can't get them or can't get it at a reasonable price. And we've decided we would take on that role because we knew the only alternative to our taking on that role was to have all these businesses without the equipment or paying a fortune for equipment. So we're not going to be the be-all and end-all to all these questions. We've got to figure out how to get the other players to start playing again. I mean, even the state has dumped a load of this on us, kind of, and differentially. I mean, Prince George's County gets stand-up testing sites and the first or second walk-in site in the state, and I've got the second highest cases in the state and the highest number of deaths, and I can't get a walk-in site funded by the state. So we need everybody else to kind of play the role they're supposed to play in this. And we'll do what we can do. And I think we've shown that, we're able to be flexible and do more, but we should not be the primary source of relief. We need help.
All right, looking for hands. No hands. You all have Zoom and Microsoft Teams and Google Meet fatigue at this point. I understand. I'm sure it's been a long day for most of us staring at computer screens.
I think you missed another one of the various things that people can use that drives me totally crazy.
I'm sure there's another interface that I'm missing.
Yes, there are at least 4.
Yeah. So I'm sure our eyes are tired at this point. Any last questions or anything before we bring it to a close here? Elizabeth in the chat, the housing
question actually. Oh, sorry.
Okay, Pete, let me get to this one, and then I think I'll get over to the housing issue is huge. Can we talk about how we can get ahead of homelessness, growth, etc.?
It is huge, and this is certainly an area, and the question is timely in that for 2 reasons. Number one, it goes a lot to what Marc has just said, the county executive has just said.
Marc works fine.
Where this is probably not an issue that Montgomery County can solve by itself. It's a huge issue. That said, I do expect that you hear some news on this particular issue this week, because the housing group has come far enough on their work where I think they're going to be proposing some things that we will utilize some of our coronavirus relief funds. I don't want to preempt this because it hasn't really fully made itself up through the structure yet. And it's not I don't have a final draft of this, but the Health and Human Services and Housing, this is that joint group eviction prevention, talking about homelessness. The county is going to be playing a role in this in terms of supporting protection of our residents from losing houses. We can't play the only role. We need federal and state support and the continued advocacy around that to do it. But the county recognizes this is a big issue, big issue. One with some relatively immediate implications in terms of when the moratorium for evictions is lifted. We are watching that closely. I would expect, and we've had conversations with the county council about supporting, I would expect we will see some movement on this particular issue very shortly. And frankly, what we do in the initial short term will sort of delay some of the other impacts, but there's going to have to be a whole lot more conversation about that.
Just to put it in perspective, the nonprofits said they needed $50 million by December. That's just for the nonprofits. That assumes that in December, everybody's back to work and has a job and will be able to pay January rent. Good luck with that. We have no affordable housing in this price range, and the county still does not require people to build affordable housing in this price range, so nobody should be terribly surprised at this. It's going to be an ongoing challenge. The only hope is that when the landlords realize if they evict 20 to 30,000 people, which would be the county's number, and probably similar numbers in Northern Virginia, DC, and Prince George's County, that A, there's no place for those people to go, and B, there are no tenants to move into your apartments who haven't already been evicted. And the worst part about the eviction, I don't know if it's the worst part, but on top of this, I guess you adding insult to injury. If you're evicted, it's very likely that a judge will also rule that you owe the past due rent and any months on your lease that you haven't paid so far. So if you had 3 months left on your lease and you missed 3 months of rent, the judge could attach totally legally 6 months of rent to what you owe the landlord. And just, in a country where some enormous portion of our population doesn't have $500 they can access, now imagine what people are going to have to do if they have to access 6 months rent. It's not going to happen. They don't make enough money to do it. These folks aren't in income brackets where they've got money saved up. And I'm just hoping that the landlords realize that they're going to get tenants with amazing debt from some other place, if that's what it comes down to. But the other thing I hope is, and I talked to Trent about this, is to give money to the people at the back of the line. The Republicans have an allergy to giving money to undocumented people. And then the other allergy would be just to poor people in general, but undocumented more than anybody. But if they gave money to save the landlords, who would be foreclosed on by the banks and financial institutions, they could probably wrap their heads around saving a landlord's campaign. And if we've made it conditional on giving out the money to the landlords, that they forgive the rents of the people who owe them the rent, because it wouldn't make any sense to both give them the money and let them sue people for back rent. That's the only way I see getting out of this hole. And I think you got to do it for commercial property too, because you're going to have a ton of small businesses who face the same 2 to 3 months of non-payment of rent and whatever's left on their lease. And people have told me that if the landlord says they want the back rent, they're just going to close up and not open up again. So somebody's got to come to their senses in this. And I, by the way, do not have enough money to do this.
If I could make a comment, I've spoken to a couple of property management offices about possibly using the security deposit towards the rent, and they all completely balk at that.
Yep.
And I'm wondering, like, is the county communicating to property managers? You know, is there communication going out about what options they can, you know, offer to people and whether those things can happen?
I don't know what the latest stuff is from our staff, but I communicated with AOBA early on, and they assured me that people were going to, be willing to work out repayment agreements. The problem is that if you're barely scraping by to make the rent you're making now, it's going to be very hard to make a repayment, for past due rent. So I do not yet feel that they have reached a realistic point where they're looking at this and saying, yeah, this is what we're going to be able to do. This is what's likely, and we're going to have to accept some losses here. I mean, and no surprise, it's always the banking institutions that don't seem to ever have to endure any losses. Their plan is they will be made whole no matter what the damage. And we've got to figure out how to spread some of this pain around, because there's too much pain for the people in the lower income brackets to absorb. It's just way too much.
Yeah, I'm not going to preempt too much our conversation on the 28th, because I think we're going to talk a lot about the housing issue, because I think that's the group where we're going to have some of the deliverables, both a communication strategy, to your point, with the property management companies and landlords, as well as a potential program that will need some conversation about how we roll it out as it relates to the county's effort to help out those who are facing eviction. I will say that AOBA actually is in the work group discussing it with the county, and so there are certainly landlord representation, property management representation, as well as HOC and the other opportunities we have across the county government are represented, nonprofits as well, and making sure that there's a diverse representation in these discussions, because having a discussion without the property management companies and landlords does not make sense either. You want to have landlord representation, tenant representation, and have them, have the county sort of coordinate and mediate. I don't say mediate, but sort of be part of that conversation. But all the partners need to be involved.
Can I ask a logistical question about the frequency of these meetings and whether or not you'll be sending out a calendar or a calendar of some of the other related meetings that we are able to join if we're able? How will those be scheduled, and how will that work?
Hey, Elijah, that's basically where I was going to come from also. What's the roadmap for the next steps that we're going to follow before you wrap this meeting up?
So our next meeting is going to be on the 28th, and obviously you all will receive the recovery report prior to that meeting, along with the slides from today, with the expectation that you once again view the recovery report through the lens of racial equity and inclusion, right? But what we want to do is have a discussion with you all, considering the recovery process anywhere from 3 months to a little bit longer, depending on the time frame of this entire event, around what you all feel the frequency should be for these meetings specifically. I think that in mind, when we first came together, our thought was that we would meet twice a month. However, due to certain issues as they emerge, you all may feel that it's more important to meet more frequent than that, as a part of maybe some of the subgroup topic areas that we discussed earlier today. So we really wanted to have that discussion with you all to allow for you to weigh in and dictate to us what you felt was appropriate.
And will you be assigning us to subgroups, or are they fluid? How will that work?
So we thought about that, but when we sent out the survey, so many people chose so many of the same subgroups, which is why we grouped these first two together, so that if you wanted to be a part of equity and inclusion, you didn't have to choose one or the other, right? That you could essentially do both at the same time. And so we don't want to do that and take up all your time, obviously. We want people to be able to rotate through them all as much as possible. So we're going to group some of these items together. As specific issues emerge, you may say, hey, we need to pull out this issue area and look at it specifically as it relates to this subgroup, and maybe meet separately from the larger group to discuss that. So once again, it's really up to you all as in terms of how you want to go forth with that process. What we do know is that the next meeting is going to be on the 28th at 7 p.m. And prior to that, you will receive the Zoom link as well as the other information from today's meeting. And maybe what you may want to do is in between now and then is start to consider what you think the frequency should be, or maybe what it should look like, especially after we have that upcoming meeting, and be able to weigh in and provide feedback following that. Does that work for folks? Once again, fatigue. So we appreciate you all volunteering your time and your talents and your efforts to this mission. We all know that it's important, but obviously you all have home lives, families, and other things. I've got a 4-year-old upstairs asleep right now. So, in consideration of all those things, we want to be respectful of the time commitment that you're making to this. Earl, anything to add?
No, what I would say is we can certainly send out maybe a doodle poll to try and get some sense of what everyone thinks the meeting frequency should be. Maybe we can work on scheduling the next meeting after the 28th, and then just, I don't want to say play it by ear, but let's see how the workflow goes and maybe make some, I want to give you enough lead time so you can make the meetings, but at the same time, allow everyone's comfort level to dictate how often we meet. And frankly, a little bit to do with the deliverables. I know what we'll talk about for the next meeting, but obviously we're reviewing works in progress. And so I want to make sure that we've got enough to discuss. Today's call was a lot more about process, and I recognize that it's going to be a lot more focused on actual deliverables as well as, core areas that you all want to talk about. So I think part of this too will be, we'll have some document review, but I also think that, now hearing from you all, topic areas that you all want to talk about will be important as well, because we just got to arrange for people to come who are experts or who are missionary leads or who are work group leads to come talk to you all about whatever it is you want to talk about. Very much not trying to be prescriptive about this. We want, Elijah's going to help lead us from the community side. You all tell us what you want to talk about. That's the key for me.
We're right up against it. Before we close here, I want to make sure, yes, and we will be sending out the slides to everyone. The slides, the recovery report, expect to get all those things. The agenda, if after reviewing the recovery report, you have any questions in advance that you want to ask or have us prepare for the next meeting on the 28th, please do send those in advance so that we can be prepared to discuss that during the course of that meeting on the 28th. But as we come into a close here, what I do want to do is offer Marc and or Andrew any last comments.
Thank you, Elijah. Greatly appreciate your leadership. Looking forward to working with this group. I've already, just this discussion, even though this was just a kickoff and kind of getting ourselves acclimated, a lot of ideas that that we hadn't thought of, and I'm sure there'll be a lot more of that. And really need your input as we move forward. So thank you to everyone. I know this is a additional time commitment on top of, I'm sure, a lot of others for everyone. But you're making a great contribution, and I would just ask you to stay healthy and look forward to seeing you at the next meeting.
And I'll just say, look, if we had all the answers, we wouldn't have convened the community-wide committee. We are facing unprecedented times. We know pretty well that the way we do things traditionally is not going to get us where we need to go. And so we need new eyes, and more ideas on the problems we're facing so we can figure out what is the best path forward. So there's no wrong question. There is no wrong possible answer. And we really have to I would not be discouraged by the fact that a lot of these are daunting and, you know, and are going to be challenging. Like I said, if we knew the answers, we'd spare ourselves asking you, or spare you the invitation to being part of this. But we hope that everybody gets to be part of a creative process to help reimagine how we run the county. Thank you.
Earl, any closing comments?
Thank you all for being willing to participate in this group. I 7 bullets of information here that, you know, things that we can do or things that we need to, you know, talk more about from you all. And I appreciate very much that you all are willing to come from 7 to 9 on the Tuesday night to give us your feedback and represent your communities.
And I thank you all as well. I want to thank Earl, obviously, Adriana, Tina, Ryan, Vin, the team for putting this together. This isn't an easy lift. It's a pretty heavy one. We want to thank you all, obviously, for your time this evening, the county executive, the county administrative officer as well, for spending some time with us. Looking forward to the work, folks. Anything worth having is worth working hard for. We do know that our community is worth working hard on behalf of. So look forward to working with you all moving forward. I'm going to give you back 2 minutes here. Go eat some ice cream, some dark chocolate, maybe have a glass of wine. Enjoy the remainder of your evening. Be safe, folks. Practice social distancing. And we'll see you on the 28th.
Good night.
Thank you.
Good night. Thank you.
Good night.
Everyone be safe.
Thanks, everyone.
Thanks, everyone.